started. All right, ready. So when we talk about smoking, when someone mentions smoking, the first thing that you probably think of is tobacco cigarettes, because that's the most common. But there are other types of smoking. We're going to talk about tobacco cigarettes. We're going to talk about e-cigarettes, which is the newest of the things. There's cannabis, also known as marijuana. There's other tobacco-type products, like cigars. And there's cocaine. However, I do not have time to talk about these last two. They're bad for you. Don't do them. Okay. So why are adolescents smoking? One of the big reasons is experimentation. You guys are growing and developing, and you guys like to try new things. And this is unfortunately one of the things you like to try. You're more at risk for smoking if you tend to have smokers in your family or you have friends that are smoking. And there is social pressure to try something new. There's also a lot of marketing for it. Now in the United States, it's illegal to directly market to kids. However, there's a lot of indirect marketing that happens, and I'm sure you can think about a TV show that you saw recently in which the cool star was smoking. Kids who are depressed are more at risk to try smoking. And kids who have had adverse or stressful experiences like divorce or death in the family are more at risk for trying smoking. So let's talk about cigarette trends a little bit. 90% of adult smokers have tried their first cigarette before the age of 18 years old. Daily in the United States, around 4,000 young kids, 12 to 17 years old, start smoking, and around 2,000 of them become daily smokers. In 2011, about 4.3% of middle schoolers admitted to smoking, and good job guys, that has decreased in 2016 to 2.2%. So very good. Who are the kids that are smoking? Well, there's a higher prevalence in white kids, lower education, and lower income. So what is in a cigarette? Main one, tobacco, which contains a chemical called nicotine, and we'll talk about that in a little bit. 2, there is hundreds of chemical additives in there. 3, a filter, and 4, the paper. So burning a cigarette contains greater than 7,000 harmful chemicals, and over 70 of them cause cancer. So what are the immediate effects of smoking cigarettes? What happens to you if you smoke right then and there? 1, it smells awful. I'm sure you guys know when someone has smoked a tobacco cigarette when they walk into the room. It's a pretty strong scent. 2, it stains your teeth. It's kind of gross. And 3, probably the most important one, is it decreases athletic performance, right? If you smoke, you are not going to do as well in your sports. But there are long-term consequences to smoking, and I'm sure you guys are familiar with these. So it is the leading preventable cause of death. I want to stress that it's preventable. If you do not smoke, you do not put yourself in these risk categories. Greater than 400,000 people die annually in the United States due to cigarette smoking. It is the most important risk factor in developing lung cancer. And why you care about lung cancer, it is the leading cause of cancer death in men and the second leading cause of cancer death in women. It is also the risk factor for developing many, many, many other types of cancers. And it's not just cancer that cigarette smoking causes. 33% of all heart deaths or cardiovascular deaths are due to cigarette smoking. Now this diagram over here, which you can't see with the really, really, really tiny writing, is all the other litany of things that cigarette smoking causes and does to your body. Basically, smoking affects every organ in your body. But I just want to do a couple of highlights for you. It increases your risk for infections. It can increase your risk for type 2 diabetes and hip fractures. It increases your risk for dental disease. So if you like your teeth, don't smoke. If you have asthma, it will cause your asthma to flare up. And I'd like to point out this reproductive disorders one, because if you smoke, you tend to have more problems with your reproductive organs, which means for women, you guys are going to have a harder time getting pregnant later on in life. And for men, you get a wonderful thing called erectile dysfunction, which means you're going to have a hard time getting it up later on in life. So let's talk about e-cigarettes, right? This is the new thing. This is what we need to know about. So it's an electronic device that uses a battery to aerosolize a liquid that you put in. There's different types of liquids that you can put in that is inhaled by the user through a mouthpiece. There's all sorts of different types of them. We have e-pipes and e-cigars, and there's these things called tanks, and then at the end there, those are the e-cigarettes that actually look like cigarettes. There's, of course, a new thing, because there's always a new thing, and it's called a Juul, right? So this is a highly concentrated nicotine vaporizer that resembles a USB stick. So it's hidden, I guess. So let's just talk about some basic facts with e-cigarettes. It entered the US market in 2006, so it is a relatively new thing. In 2011, only 0.6% of middle schoolers used e-cigarettes. It's good, it's very small. However, there was an increase. In 2015, e-cigarettes became the most commonly used tobacco product by middle schoolers and high schoolers. Now, for the older adolescents, there was a drop from 16% to 11% in 2015-2016. But unfortunately, for your guys' age range, the middle schoolers, there was an increase in 2016 to 4.3%, which is why I'm standing up here and talking to you today. So who uses it, right? Younger, more educated, higher income, and white. No gender differences. Tends to be non-daily users, and current and or former tobacco cigarette smokers. So this ties in with the tobacco cigarette, right? We talk about tobacco cigarettes have a chemical in it called nicotine. The most common liquid that is put in e-cigarettes contains nicotine, okay? So let's talk about the problems with nicotine. Now the brain continues to develop into your early to mid-20s. So we'll look at this nice 5-year-old little brain. It's got a lot of yellow and orange and red. That is growing tissue. As you start going through and getting older and older and older, you'll start to see more blue tissue. That's more mature tissue. So until you get into your 20s, that's when you see the most amount of blue. But you guys right here, you guys got a lot of yellow, orange, and red. You got a lot of developing tissue that's going on. So what happens when you inhale nicotine is it disrupts the formation of your brain circuits that controls attention, learning, and your susceptibility to addiction. So what that can lead to is mood disorders and a permanent, can I stress that word permanent? Lowering of your impulse control. It also affects this area in your brain called the limbic system, which when that gets activated, it increases your risk for addiction. You guys are more at risk for getting addicted to this stuff. It's also associated with an increased use of other tobacco products and illicit drugs. Nicotine also has effects on the body, and it will increase your heart rate, and in high doses it can cause nausea, vomiting, and eye irritation. So the biggest thing that I want you guys to take home from this, though, is that nicotine dependence is a problem. It is strongly addictive, especially in your age range. The younger you are, the more at risk you are for developing a dependence on nicotine. And symptoms can appear within days to weeks, even in occasional use. So I know you think that's, if you have to smoke cigarettes daily to get addicted. In your age range, you do not have to do that, okay? Now, in e-cigarettes, there's a lot of other things too. So the liquid that gets put in, there's also things called ultrafine particles, which will cause a lot of cough or chronic congestion in your lungs. There's flavorants in there, like diacetyl, which we're going to talk about in a second. Propylene glycol and glycerol is also found in that liquid, and when it gets broken down, it turns into formaldehyde, which you may remember is the chemical we use to preserve frogs or humans for dissection, and acetaldehyde. Now, acetaldehyde, volatile organic compounds, and heavy metals, those are all carcinogenic, which means they cause cancer. So diacetyl exposure is linked to a condition called bronchiolitis obliterans. But it's got a really fun name. It's called popcorn lung. And the reason why it got the name popcorn lung is because there was an increased incidence in workers who worked at microwave popcorn plants. Diacetyl is used to flavor popcorn, and when you ingest it orally, it's not problematic, but when it gets aerosolized, it becomes a problem, and you can develop this condition. And as you can see from the condition over here, basically it causes giant holes in your lung, which means then your lung doesn't work, which means then you can't breathe. The biggest problem with this is we have no medication for it. It's incurable. So if you develop this condition, the only treatment we have is a lung transplant, which is not a good option. Now, we don't live in a vacuum. You guys live in a house surrounded by other people, I'm sure. And this house you may have little cousins, you may have little siblings. So this becomes a problem for other people around you. The liquid vials that e-cigarettes, that you use to put into e-cigarettes, little kids like to get into those. They don't know what they are. And nicotine can be absorbed through the skin as well as ingested. So we've seen an increased incidence in nicotine poisoning because of that. Also, when you exhale and the vapor goes out, nicotine is put into the environment. So just like with tobacco cigarettes and e-cigarettes, there is an increased incidence in sudden infant death syndrome. And it is very unsafe for pregnant women and fetuses. E-cigarettes are also a device, right? And devices malfunction. So we've seen case reports of these exploding on people and causing problems. And just like with tobacco cigarettes, e-cigarettes take a lot of heat in order to vaporize that. So we've seen an increase in burns because of it. Now the question that I get asked about e-cigarettes is, isn't it safer than cigarettes? And the answer is yes, it is, right? It doesn't have as much tar or horrible chemicals, cancer-causing chemicals as tobacco cigarettes, right? But safer doesn't equal safe. And so as we just talked about, nicotine is very bad for a growing brain. So it is not safe for you. Now let's talk about cannabis, also known as marijuana. Good job, guys. There's the lowest incidence of use in your age range, so yay, right? Yeah. You're more likely to use it, though, if you dislike school, if you are failing, if you don't participate in activities, right? Or if you have peers or friends that are using alcohol, marijuana, or cigarettes, right? It is associated with a lower educational achievement, increased use of other drugs, and an increased risk of death from car accidents, and we're going to explain why. So cannabis smoke still contains the same carcinogenic or cancer-causing agents as tobacco, but it has a different chemical in it called THC. So when you smoke marijuana, the immediate effects of smoking marijuana are, it impairs your attention, it impairs your concentration, it impairs your motor coordination, and it impairs your memory. So that's why we see an increased risk of motor vehicle accidents, because your attention and your motor coordination are drastically affected. It can also cause a temporary anxiety or psychosis. Because it's inhaled, guys, you can develop a cough or wheezing or airway irritation because of it. It also affects your heart rate and your blood vessels. So when you stand up, your blood pressure drops, and that can cause you to become dizzy and pass out. And because it affects how your blood pressure and your heart work, you are at an increased risk of heart attack and stroke when using marijuana. There are, of course, long-term consequences for being a chronic marijuana user. You are at a 2 to 3 times greater risk of developing a mental health condition called schizophrenia. Schizophrenia is characterized by having delusions and hallucinations. You are also more at risk for dental infections. Marijuana causes a drying of the mouth. Saliva is very good at keeping your mouth healthy, and so when you chronically dry out your mouth, it can cause more infections in your mouth. There is a condition called hyperemesis syndrome, which basically means you vomit and vomit and vomit and vomit and can't stop. And we don't know why certain chronic users develop this, but we do know that once they stop, within a day or two, they stop vomiting. And last but not least, there's a condition called amotivational syndrome, which is basically like a depression. You just don't want to do anything. You feel very apathetic about stuff. Now, those who smoke marijuana in your age range are more at risk for developing an addiction to marijuana. There are permanent changes in your memory, your learning, and your thinking. You are less likely to finish high school. There's an increased use of other drugs, and you're at an increased risk of suicide. So what the take-home point of this whole talk, guys, is growing brains shouldn't smoke. It does affect you differently than it affects an adult. Now, if you guys smoke and you want to quit, there's some great websites that you can go to, teensmokefree.gov and thetruth.com. But just also talk to your pediatrician. We're here for you. We know where to send you, right? We want you guys to be the healthiest kids that you can be so that you can grow up to be the healthiest adults that you can be. And that's all I have to say for right now. And then we have the questions if you have any of those.